Hey there everyone, and welcome to my channel. Welcome to RebelHealth. I'm Steve Murray. I'm an exercise physiologist, I'm a health coach, and my day job is as the co-founder of an organization called Health Architects South Africa. And let me tell you something, I'm really fired up about this and about what we're going to do here. So why RebelHealth, you ask? Well, I call this channel RebelHealth because I can't just keep accepting the status quo. Did you know that by the end of today, the 24 hours which is today, roughly 120,000 people would have died from preventable and treatable conditions? That's right, 120,000 people every single day, 7 days a week, 365 days a year. That's a staggering statistic, and it's only getting worse. So think about it. We shut down the world for COVID-19. Now, we had penguins, walking down the main street in Samson in Cape Town. This is where the humans used to live. And even at its peak, I think it was January 21, 2021, daily deaths from COVID reached about 90,000. Do you remember the global focus on flattening the curve? But for these preventable diseases, there's no curve flattening effort. It's just considered, business as usual. Doesn't that just seem crazy? So, the obvious question, who are you? Why should I listen to you? And what gives you the right to voice these kind of issues? That's a great question. So I've spent over 30 years immersed in the world of health and fitness. I've traversed the entire sort of wellness, illness continuum, if you will, from elite athlete performance on the one side to cardiac rehabilitation and chronic disease risk reduction on the other. And did a bunch of stuff also in the middle. And that included a successful 15-year stint as fitness director for Virgin Active South Africa, where I gained invaluable insights into the fitness industry and their challenges and opportunities. Subsequent to that, I partnered with a remarkable team of people to develop corporate well-being programs. And we did about 180 of them. This was a decade-long endeavor that culminated in global recognition for our innovative approach. Today, I work in a primary care medical setting. So through these experiences, I've developed a pretty deep understanding of the complexities faced by both the healthcare and fitness or wellness sectors. I witnessed firsthand the skepticism that medical professionals hold towards what is very often wild, unsubstantiated, and sometimes dangerous claims we see from the fitness industry, while I also comprehend the fitness industry's frustration with the slow pace of change in clinical practice. 17 years from when the science becomes generally accepted to seeing a change in clinical practice, and that's the average, by the way, it's not good enough. And the medical industry's reliance on a pharmaceutical-centric model that very, very often neglects the power of prevention and lifestyle modification. And that presents a real and significant challenge. So I think I've got a unique perspective bridging the gap between these two worlds. And that, I think, allows me to offer a comprehensive view of the issues and the potential solutions. It was the COVID lockdown that really sort of made me realize I needed to make a bigger impact. And that's when Health Architects was born. I'm blessed. My partner, Jenny Haig, is a physiotherapist and a functional medicine practitioner. And she has a really deep understanding of the root cause of chronic disease. And together we committed ourselves to change not only what we do every day, but also to really understand why we did it, or why we do it. We are determined to find what actually works when it comes to health and health outcomes, changing health outcomes. Some key challenges, let's look at those. Traditionally, the entire industry has operated on two primary commercial models: fee-for-service or fee-for-access. The fee-for-service model is often associated with sick care, and that places the healthcare provider or the healthcare professional in a position of authority. Patients are charged for each service rendered regardless of the outcome. This model creates an incentive to maximize procedures and treatments rather than focusing on prevention or taking a holistic approach. On the other hand, the fee-for-access model, commonly found in the fitness and wellness industry, centers around providing access to health-related products or services. Payment is made up front for gym memberships, for health programs, or for health products, but without guarantees of specific health outcome changes. While this model can more likely encourage preventative measures, it still lacks accountability for results, and it may not address the underlying health issues of the individual concerned at all. So neither model adequately addresses the complexities of modern healthcare. And that's why I think we need a more patient-centric, more outcome-oriented approach. So what are our options? How do we deal with this? As I said, there are kind of two primary options. We can have a confrontational approach, focused on criticizing the other side. So simply standing on the outside and throwing stones. Or we could take a collaborative approach that's centered on education and centered on shared understanding. I promise you there are plenty of people who have adopted the confrontational model. And it is certainly significantly easier to get attention that way. But I still believe that the collaborative model is the most promising path forward. Whether we agree with the current system or not, the medical profession has been tasked with managing the escalating crisis of chronic disease, a task that they are A, not trained for, B, not managed on, or 3, remunerated to do. But rather than criticizing the situation, we propose a collaborative approach to build a comprehensive care pathway for patients and participants on programs, what we would call the continuum of care, by harnessing the expertise of a multidisciplinary team that includes healthcare professionals and medical professionals, fitness professionals, and other specialists, other relevant specialists. We can improve health outcomes. To achieve this, we need to look at a fundamental shift in the healthcare business model. And we're a big fan of something called fee for value, a payment model that rewards providers for quality of care rather than quantity of services. And this is one potential solution. This approach fosters shared responsibility between the healthcare provider and the user, the consumer, the patient, ultimately leading, we feel, to better health outcomes. And we're going to really delve deeper into the intricacies of that fee for value model in a subsequent discussion. So, I'm not a conspiracy theorist. I don't believe that there's a cabal of flesh-eating Democrats in the pizza parlor underneath somewhere in Washington. I'm not suggesting that there's some evil plot to make us sick. But let's face it, Big Pharma and Big Food have the kind of budgets and the vested interests to shout very, very loudly, and the loudest voice in the room is often the one listened to. We are bombarded with information, not all of it accurate. The truth is, a lot of what we hear about health just isn't true. And that's on both sides of the fence. Only 20% of nutrition research would pass any level of academic muster. So there's blame, there's lots of blame to hand out, but that seems pointless to us. At RebelHealth, we are here to challenge the status quo and empower you to take control of your own health. We'll be talking about the root cause of illness, practical strategies for prevention, and we will debunk the myths that hold us back. But we will always be evidence-based, and we will call out fake news wherever we find it. We'll talk to experts on both sides of the fence, so to speak, and we'll work hard to find a new model where we prevent, treat, and ultimately reverse chronic disease. So are you ready to become a health rebel? Subscribe to our channel. Subscribe to the channel, hit that notification bell, and let's get started on this journey together.